Hi, I'm John Solomon, Editorial Director of the Aspen Institute Sports and Society program. Welcome to our conversation about how coaches can help kids with mental health challenges. The pandemic over the last year and a half has increased the number of kids struggling with mental illness. According to the CDC, between March and May of 2020, hospitals across the country saw a 24% increase in mental health emergency visits by kids ages 5 to 11. There was a 31% increase for kids 12 to 17. The overwhelming demand for mental health services is putting an unprecedented strain on pediatric facilities, primary care, schools, and community-based organizations that support kids' well-being. So how do we build capacity for coaches and teams to help younger athletes, who are often conditioned to hide their emotions, speak openly about their struggles? Joining me today to discuss this is Dr. Kevin Chapman, founder and director of the Kentucky Center for Anxiety and Related Disorders, and a mental health expert for TrueSport as part of the U.S. Anti-Doping Agency. Kevin is a clinical psychologist who has extensive experience working with athletes at all levels, from youth sports all the way up to professional and Olympians. First, let's talk about what we mean by mental health, because that can be a vague term that's often used generically in conversations. When we talk about mental health challenges for kids, what does it actually mean, and what have you been seeing happening right now with youth athletes during the pandemic?
Yeah, it's a good question. I think that when we think about mental health, we're talking about the health of one's mental capacity. That means emotional regulation, ability to navigate environments based on emotional regulation skills, how that affects a youth athlete on the field, off the field, in the classroom, with peers, etc. And I think what we find is a significant increase since the pandemic, of course, of things like anxiety and related disorders, things like that. So ultimately, we've seen a huge uptick, not only in just athletes and youth athletes at that, but also their family members, their parents, even teammates and coaches and such. And I think that, that's something that we're going to see for quite some time, because anxiety, for instance, is one of those things we all experience, but we're starting to see that at a much more chronic level, because people who didn't have anxiety at a clinical level prior to the pandemic are manifesting at a clinical level, and those who didn't necessarily manifest at all are starting to express anxiety. So in many ways, we're finding a lot of youth athletes at this point being very vocal about it and saying that they need help of some sort.
So that's at least good that they're being vocal, right, about it, that they're voicing some of their concerns. What can coaches do to help? And taking a step back first, how prepared are coaches to even help, and have they been trained when it comes to mental health skills?
One of my soapbox issues, honestly, when it comes to working with athletes at all levels, is that I think historically, and I was a former athlete as well in college, playing football and running track, I find that most sports cultures don't really facilitate a conversation about mental health. In fact, it's not something historically that's been talked about. Not only in general society has it been stigmatized, right? But also specifically in sports culture. Many boys, of course, are taught, hypermasculinity, don't express emotion, and things along those lines. So I think that it's been suppressed. And I think ultimately coaches are relatively ill-equipped to be able to handle that, because in many ways, some of these coaches are dealing with the same symptoms themselves on the one hand. And on the other hand, there's not really been a cultural shift, so to speak, in a sports organization or team for a coach to have and facilitate such conversations that obviously need to be had at this point. So I don't think we've done an adequate job, honestly, of equipping coaches with having these sorts of conversations, which are inevitable at this stage of needing to equip these coaches.
So what does it take to equip them? Like, what in your mind, what are some basic things that you think coaches could be utilizing and tools in their tool shed, essentially?
Yeah, that's a great question. And I think that many of the things we say to coaches and how we can help coaches also is echoed by what we can say to parents. And I think first and foremost, we have to have a very open door to even have honest conversations about mental health and wellness. So first of all, it has to be a safe environment established for coaches to even have a space that's created for our young athletes to be able to vocalize that they're struggling with nerves, which ironically, I was having this conversation yesterday with someone, and we talk about things like nerves, and nerves really has a physical connotation, right? It's less stigmatizing to say that historically, when in reality, it's anxiety, right? So having an honest conversation about the symptoms that an athlete may be expressing, number one, is allowing that to be a safe space, not to further stigmatize the expression of symptoms or even vocalizing those symptoms, number one. Number two, and this is the biggest issue that I have, John, is that I think in pretty much any sports culture at any level at this stage, we have to be very explicit about teaching mental skills alongside physical skills at this stage, especially in the United States and our sports culture, which is a fabric of our identity in many ways. So I think in some sense, we have to start from the outset when we have kids running gassers and doing push-ups and doing squats and doing bench press and running and doing suicides and such. I think that we also need to be talking about mental health. We need to be talking about anxiety being a normal part of competition. We need to be talking about those things and equipping not only the coach with a toolkit to be able to do that, but also to facilitate that with parents so they can echo what's being taught on the field.
I've heard you talk in the past about the right ways for coaches to talk to athletes, and you've talked some about the difference between success seeking versus failure avoidance. Can you explain a little bit what you mean by that and how that fits into this conversation?
When we think about the science of psychology, and if you want to say sports psychology, it's really the science of the psychology of playing sports, right? So ultimately, everything that we talk about as it relates to an athlete, a coach, a teammate, etc., all has to do with the science behind the strategies that we employ. So when we think about success seeking versus failure avoidance, we're simply talking about having a tone and a conversation with an athlete that is reinforcing rather than punishing. The example I like to use is a lot of coaches try to motivate athletes by punishing, and unbeknownst to them, for example, stop turning the ball over, right? Like that's a punishing statement. It's telling you, don't do that. When in reality, we've known since the beginning of psychology that what increases behavior is using a statement that's more reinforcing. So the same coach can shift don't turn the ball over by saying, have better ball control. It's conveying the exact same thing, but ultimately it's saying what I want to see you do as opposed to what I don't want to see you do. Because many athletes are notorious for thought suppression. Don't do that. Don't say that. Don't think this. Don't shoot right. Don't slice right. And what happens? You do that thing that you're trying to suppress. So actually saying what I want you to see not only increases behavior, but it also increases the confidence that an athlete would have and need to achieve said specific action.
That's interesting. So, in other words, there could be coaches right now who, just by their own words, could be increasing the stigma related to anxiety or, mental health challenges through maybe no fault of their own, that they just don't necessarily know better, but what they're saying is just the wrong thing to say.
And the thing about that, John, to your cogent point, is not only that, but that is a learned association. So what they don't realize when they make such a powerful statement is that an athlete internalizes that. And many athletes struggle by default with equating their performance with their identity, and therefore you've created a bigger problem, especially if that's getting reinforced at home. So it's a much bigger issue than it sounds at face value, right? Because that's a seed plant that gets watered and ultimately causes a lot of athletes, and triggers at least, to struggle with more clinical severity in terms of their symptoms.
So, look, coaches, of course, will never be trained psychologists like you, right? I mean, but there's certainly, we agree, there's more they could be doing. What's a reasonable expectation of what they should be doing? Like, what are simple ways that they can get trained, or they can, take some skills from elsewhere to develop on their teams?
That's a terrific question. And again, if I had it my way, what I would say, John, you mentioned TrueSport and my affiliation with TrueSport. And I think that, just to be clear, one of the things I love about TrueSport and why that I'm on the TrueSport team is because we share the same mission and values in terms of what we want to do with athletes and what we want them to learn. Being an athlete is one of those things that is preparing you for life. Like I tell my family all the time that, being an athlete literally prepared me for what I'm doing today, and I learned so many skills. I say that to say that, yes, a coach won't be a psychologist per se, but I think there's a tremendous amount of resources out there, hence TrueSport, where coaches can be trained on many different lessons and skill sets and things that they can infuse in their curriculum, quote unquote, on the field, on the court, on the pitch, or whatever sport it might be. So I think that when coaches are being trained, again, like continuing education credits, which is true for most professions, I think in many ways they have to have lessons that speak to leadership, communication, nutrition, right? Healthy play, right? Bullying, what is that? How not to do it? What are the things I can say to an athlete that would be reinforcements? What about performance anxiety, mental imagery? I mean, the list goes on and on and on and on and on. It's like an auctioneer. The point is that if you take all those ingredients, these are all things that are readily accessible to coaches. I just think that we have to do a better job from a top-down level at making them more aware. In fact, I'd argue that it needs to be mandatory.
Can you estimate, again, just recognize it's a ballpark figure, but what percentage of youth coaches, high school coaches out there do you think are adequately trained in mental health skills?
You force my hand, John, which I'm fine with. I'd probably say, 10 to 15% maybe.
Wow. So it's
Very
low.
low. And I know psychologically minded coaches, John. I know a few, a few, and they are exceptional. In fact, one of my mottos is the process leads to outcome, and that's what you see in elite level athletes is that they follow a process which leads to the outcome, the scores, the wins, the points, etc. And the irony is the coaches that I know who are psychologically minded have very good outcome.
So say you're a youth sports organization out there, a high school out there, you're hearing this, but there's also the fact that, look, some coaches out there are really old school, and they don't necessarily want to adapt by incorporating mental skills training into their teams, or they don't have the time. How do we change that? How do we make sure they understand the value of this, and that it's important or maybe even required, like you were talking about?
Well, that's a great question. I think that, some people, there's a lot of psychology behind the question, right? So many people are going to cling to previously held beliefs. We call that the belief perseverance effect, despite overwhelming evidence to the contrary. So like you said, people are just going to be old school or OGs, if you will, and just stick to their guns, even if they're not working. So there's that piece. But on the other hand, I think that we have low-hanging fruit, John, at this stage in our country. We have all these high-profile athletes who have these really large platforms who are speaking out now and being very vocal about mental health, right? Like we can name countless athletes now and talk about it. So in many ways, it's one of those things where it's, if you don't see the value now, when are you going to see it? Because many coaches, unfortunately, wait until there's a huge problem. For instance, like athletes I've seen who, some of which have been suicidal as a result of things happening on the team, and coaches really don't do anything until they have to. So I think in many ways, it's really paying attention to the platform that's been established and recognize the truth about emotions that many people don't know. And that is, we all have them, and they're all normal. And we all get angry when we play a sport. We all get frustrated when we play a sport. That's not the issue. The issue is, how do I respond to emotions so they can affect my outcome as opposed to inhibiting it? And I think when coaches can recognize how many athletes with big voices there are now talking about mental health, then they're going to be able to see that that's going to affect their program and make incredible, youth later. They'll become phenomenal adults off the field, but also it will lead to victories and outcomes and so on and so forth. So,
yeah, I think we're really seeing a cultural shift when it comes to mental health in sports. Michael Phelps, Naomi Osaka, Simone Biles, we can go on. And the message is a good one, right? It's okay to not be okay. We're all dealing with these things. But I wonder, like, when you're a child, when you're younger, and you face peer pressure, or you face the inability even to put into your own words what you're feeling, particularly if we're talking younger, or maybe they've gone through some trauma, right, and they just can't speak to it. Putting yourself out there like that may be different than a pro athlete. How can we help kids talk more openly within the sports setting the way that the pro athletes are starting to do?
Yeah, that's a good question. I think that the main thing is it starts with parents and caregivers at that point, John. I think that ultimately you are a product of your environment in one way or another. And I think in many ways, this is where we get to the parent conversation, because I think for parents and caregivers and guardians to have a safe space and create that safe space to have these conversations, point A, is the most important component. I think the second component is recognizing developmentally youth, as we know, tend to somaticize much more than older kiddos and, of course, teens and adults. So they talk about, their body hurts and then my stomach hurts. And we tend to somaticize problems and symptoms as opposed to say what you and I would say, John, like, oh, man, like, I feel like I'm having a panic attack, right? Like, they don't know what that is. So I think ultimately talking about mental skills and being okay with that at a developmental level, talking about like body scans and talking about how those feelings are normal and how we can confront those feelings and how that will affect us in a very positive way. And we can make that work for us and not against us, and kind of explaining at a developmental level what those symptoms are, I think is a really useful way to help younger kids, and especially when their parents are on board.
Last question. What is your, maybe biggest concern, and what is your biggest hope when it comes to mental health in youth sports? If we do things the right way, what might the outcome look like? But if we maybe keep going down this path, if we don't have enough people trained in it, what might be the consequences?
I think that the mental health stigma will increase and that we will see a lot more clinical cases if nothing is done about it. So if we continue to sweep things under the rug and do what I call damage control, or, John, what I like to refer to as an intervention versus prevention, then I think that we're going to see an escalation of mental health symptoms and clinical disorders in kids that we probably could have helped, right? So I think that if we continue to do that, we'll have an increased stigma, and I think we'll see a lot more clinical cases, which is what we're trying to prevent. Hence my second point. What I do hope for and what I'm thinking is happening based upon the platforms we just talked about is more of a preventative approach. If we can capture youth and their families and their coaches and their organizations early and infuse mental skills as that's just what you do, is you do mental imagery and performance anxiety and things like that and self-talk, and it's okay to not be okay early on, then that becomes more of an automatic response that not only affects the process of competing, it affects the outcome of competing. And for me, selfishly, I think more importantly, it affects us having future adults who are successful. They're successful leaders, they're successful communicators, and they're doing well and contributing to society in a very positive way. So that's what I hope will happen, and I think that's what we'll see if we can get enough people on board.
Absolutely. It's being a lot more intentional, I think, when it comes to mental health. Well, that's all the time we have for this discussion. Kevin, thank you so much. Really enlightening conversation. There's clearly a lot more that coaches can do to support kids' mental health, and we know that this is not going away. So thanks for all that you're doing, Kevin.